States as well as in South Florida, and I was the regional medical director for PricewaterhouseCoopers. And right now, basically, our world is, I think it's focusing on precision medicine and personalized programs for people utilizing Gen AI, current AI methods, and drug discovery and genomics. And genomics is becoming a really big thing in this to be able to match drug treatment plans and actually personalize drug development plans for people to increase the outcomes. And one of the things that's most important, I think, is the fact that physicians are ultimately responsible in general for the well-being of those patients. And so they want to utilize Gen AI as provided to them to improve outcomes.
And will we have a day where this technology helps us really cure the diseases we haven't really cured? There's a lot of help with cancer, there's a lot of good things that go on, but people still die of cancer.
They do, but you know, a lot of the cellular gene therapies that are coming out right now, which generally take 10 to 15 years to develop, that timeline is being shortened dramatically by AI and Gen AI because we can do simulations of thousands and thousands of stereochemistry configurations and match that to the patient's genome. And so we currently have about 40 cellular gene therapies out that are FDA approved right now. There's over 4,000 in testing in different clinical trials right now, and we expect that 85 will be approved in the next 85 more will be approved in the next 5 years.
That's impressive. Let's hope so. Julia.
I'm Julia Bartmesser. I spent over 30 years in the financial industry running technology and data transformation programs. Companies such as Citi, Deutsche Bank, where financial was my last industry job, and then last year I started my own consulting firm and joined Avasant as a distinguished fellow. From financial, it's not quite as exciting as medical potential, medical breakthrough. I think from overall, financial industry is trying to be really careful, and it's also one of the highly regulated industries with a lot of focus on transparency as well. And one of the things that currently Gen AI is not is transparent. So there is a lot of work on that's on one hand. On the other hand, there is a lot of machine learning, AI, or predictive analytics that have been part of financial services forever and ever. So way back when it was quants, and we were doing interest rate models, sensitivity models, or in mortgage industry prepayment models. So all of that was machine learning type algorithm that were trying to predict the future. So financial industry has been in this business for quite a bit of time. Of course, deep learning, generative AI gets you to the next stage. But one of the reasons financial industry has been fairly conservative in its approach is around all the model governance that's been put in place to explain to the regulators, for example, how you assess risk. It doesn't quite work for generative AI, but you have to put something in its place that makes sense, still controls for the risk of the model, but provides enough ROI to actually do it. So that's where we are currently in the financial industry.
Excellent, thank you. Jay.
Hi everyone, my name is Jay Weinstein, Distinguished Fellow for Avasant. I have spent 37 years plus in the aerospace and defense world. Started as engineering, last 20 years in cybersecurity. So I come at this actually from two perspectives, from the aerospace and defense perspective as well as cyber. Cyber coming from how do I protect and govern what I'll call this version of AI. Julie, you said it very well. We've been doing AI and machine learning for a long time. Generative AI, however, is a game changer in the speed of bringing AI to the user. That's what's really different. I mean, we've been literally developing algorithms for decades. So I come at it from a cyber perspective, just not only from protecting AI, but also what's the adversary going to do with the AI? And that's where what keeps keeps me up at night as to what is going to happen when nothing's stopping them from using it as well, and how much faster and more accurate they're going to be able to attack us, and how do we defend ourselves. So my AI world right now is thinking that through, prepping businesses for it, and I'm in a semi-retired state, we'll call it. And so I'm helping my clients, along with Avison, be prepared for that when it happens. It's going to be coming very soon.
Thank you, Jay. And Hinton,
My name is Giselle. I've been a provider inside of the healthcare industry for 20 plus years, both as a consultant, product manager, selling software into health systems, and then for the last 5.5, 6 years, I've been on the provider side. For 4.5 years at Rush Medical Center in Chicago, and for the last year or so at Penn Medicine. And I started my role at Rush doing product management and business development work. The pandemic sort of shifted my career into transformation. I was acting CIO for about 18 months, then ran a lab pharmacy as just an executive in residence there. And now I'm kind of doing the transformation of the analytics office. From an AI perspective, I don't want to double dip into Stephen's areas where he brought up from clinical areas, but certainly diagnostic imaging, predictive analytics in the hospital operations environment has been a place I've seen a bunch of go. I've consulted for a few firms. But the thing that no one talked about yet is just sort of the operational efficiency gains. The industry is at 0% margin across the United States. You get some hospitals make some money, some are losing, and some are actually here. So, but at the end of the day, like the focus on how do you get that margin profile to change. It's usually the foundational principle of, can I get a payback on my investment this year for whatever the new AI thing is. And so I've seen a lot of stuff popping up. The other part of is also the burnout issues, getting sort of NLP and ambulance technologies into the physician workflows. At first it was sort of physician satisfier, but ultimately becomes a margin play as well. When the physicians can actually get more work done, you get nurses out of the documentation, nursing and physician out of the documentation workflow, and actually doing more patient care. So that's the place I've seen most of the work. And then of course the rev cycle and back office functions, more automation, efficiency as well.
and thank you. And by the way, I'm Jim Rinaldi. I'm a fellow, but I'm also pleased to say that my experience as a former CIO for NASA's Jet Propulsion Laboratory, I also worked at FDA as CIO. I've worked at IRS, but don't ask me any questions. And I also worked at Marriott for many years. So I've spanned many different industries. And a little bit about the Fellows Program, just brief knowledge is we have about 40 people like this who are experienced in their field. They have not only working knowledge, they stay current. We utilize and participate in Avasant's research. And we gain from that, we get to enjoy being a part of that, and we can help customers of Avasant, we can help Avasant people too, with our expertise. And one of the strong points of the Fellows Program is, and where this comes from for us and the rest of the fellows, is we know how to ask questions. So if you heard this morning about prompting and things like that, we already do that, and we just call it questions. And so we are experienced in a lot of different things, whether it's one industry or multiple industries, that we can utilize our experience, sometimes deep skills, as you heard from some of our panelists tonight, that we can add a lot of value. We are a part of Avasant in terms of being part of the fellows. We are not employees of Avasant, but we are, as part of this Distinguished Fellows Program, we can be actively used to help in problems, customer issues, and things of that nature. So if you're a customer, think about us. If you're someone who's just interested in how we do this, please feel free to reach out. Rob Devers is in the room. He helps manage this whole thing, and he can get you connected. But we do have that kind of experience here. And I will tell you, in the industries I've been in, and I'll go back to Marriott, just so you know, we had and tested robots to clean the floors. And these robots, not the iRobot type, they said to be more industrial. And so we tested that out. Bill Marriott didn't care for it that much. quickly but reliably review a drug or a biologic or a piece of hardware, if you will, medical device, and do it right, we save the country billions of dollars. We save pharmaceuticals and companies that make these devices billions of dollars. So it's a very important agency. And you saw how it performed in COVID. It sped up things. I think that's a natural thing for them to do that, but it's something they did do. And you take more interestingly, though, is JPL. And I'll tell you, when we put something on Mars, we don't have interaction in real time because there's a 15 to 20 minute gap in communications. So we have to build autonomous capabilities in the spacecraft to be able to know where it's at, know what condition it's under, analyze its own telemetry data to make sure that it's in the right path, the right place, especially on our landing. Typically, we know it's going to land. We just want to make sure it lands a certain nice way. So AI has been a part of these industries. Now, what's made a big difference, and see if you guys agree with me, is Gen AI has brought it to the masses. And the reason you're all here, and the reason we're having this conference, is because Gen AI has shown us the way of using AI that was a little harder to do unless you were a practitioner with machine language and other techniques of AI. So with that said, though, let's go ahead. And I was thinking about some of the things you mentioned earlier in the operations side. Right now, when I talk to my fellow CIOs out there, there's two things they care about. They care about operational efficiency, saving money, and using AI to do that, or Gen AI to do that. But they also care about being a part of the product of the company, and they're expected to be part of the product of the company. Give us your experience of that, what you see coming in that way.
So, generally, the IT perspective at most health systems is one, you're running the trains for the systems that are in the hospital. And second, you're hopefully one of the drivers of innovation at a health system. So, what's the new capabilities that you're selling? And so, running the trains, I think that's the place where the Gen AI, the scary part of it is like how many workflows are out there that are done by humans that can't be done by Gen AI now. Cleaning up documentation, getting discharge notes for there's so much paperwork that happens in healthcare that's regulatory driven or just the right thing for the patients. So there's going to be just like those are the efficiencies you're going to have to drive. Are you going to be, as the CIO, driving innovation in that, or are you going to be a net buyer in the market? You're probably going to be a net buyer. Hopefully, because it's pretty scary pretty quickly how to use these models to drive efficiency. And on the innovation side, every health system I've seen is like trying to have IT sort of drive this adoption. When in reality, what I try to think about is like, what are the new businesses that health system wants to get in, and what are the technologies that will help drive those? So, I think there's a new care provider that's here medically home. They're driving a new care model in the market, and they're doing it because the technology is going to be there for them to drive the efficiency that health system could not. Remote patient monitoring, telehealth. I think you started to see some of these big players are getting out of the primary care business because it's not economical. So how will you use these new technologies to actually make a new clinical service, which is the business of the health system, actually perform at the economics they need? That's the place where I feel like the CIOs need to partner with the business to say, okay, you're going to do telemedicine, you're going to do remote patient monitoring. These are the technologies we're going to have to implement to make sure the economics are there. You're not just throwing bodies at a business model that's not going to work, which is why these other companies are getting out of these businesses.
And if I could add to that, many of these major hospital systems now have their own innovation centers, and they have university students that they fund with their own venture capital to develop new products that they can then bring to market and actually sell to other hospital systems. So, and a lot of these are actually jointly funded sometimes with some of the EMR companies, so that they can bring those innovations to their clients.
Stephen, I talk to my own doctors about how do you stay current. And by the way, ask your doctors when you go see your doctor, how do you stay current? If they don't have a good answer, you might want to look around. But one of the things, the challenges I always ask my doctor, do you know about Gen AI? Oh, you mean ChatGPT? Yeah, I do. And you should be using it. And how are you encouraged to stay current with things like digital technologies and things like that? So far, the answers are not very satisfying to me. But I think that's the world that has to come. And do you see that coming?
You know, it's very interesting because I was just reading an article yesterday that up until 1950, it took 50 years to double the amount of medical knowledge that was there. Now we're doubling it every 73 days. And if you can think of the exponential growth in the amount of material that physicians have to absorb to stay current, and the new drugs that are coming out, you know, it's an enormous amount of information. And so the Gen AI systems and the NLP systems that then can summarize, you know, what used to be huge, you know, medical records on people so that they can precisely not miss a certain diagnosis. And it's very important.
I think what we're going to have is, not just in the medical industry, but what we're going to see in all industries, is the first phase of this mainstream, is the fast adoption of Gen AI solutions and capability in software and applications and the things that we use today. So the medical business systems, all the medical record systems, all that is going to come out with, you know, they'll probably charge you for it. The same Microsoft model, you know, it'll be 1.5 times, and all of a sudden you'll have the Gen AI capability where the physician can just ask for the information using an LLM model. And the same thing's going to happen in every business. SAP is going to come out with their Gen AI module. They're all going to come out with the software, and therefore the software we're used to using is just within the next year or two is all going to have this Gen AI add-on to it. And we as a business aren't going to have to implement Gen AI. We're going to have to buy the software that's already implemented. And I think that's going to be what we see in the next year or two.
We've already seen in healthcare,
Sure.
the physician letters back to you now are probably, depending on the health system, pre-written by ChatGPT in some version with it by Epic, and then you approve that letter or edit it.
Yeah, there was an article, study just came out by the Brigham, Mass Brigham, where a group of oncologists couldn't determine the difference between a human written response and Gen AI. It's that close, and so the credibility.
That scares me and encourages me at the same time. So.
I can actually tell when it's ChatGPT that writes something. You know, sometimes you see the post on LinkedIn or you see any type, and you kind of did this sort of, especially ChatGPT actually, Microsoft Copilot is better, but ChatGPT you can pretty much tell that is like it just has a style of writing. So it's kind of interesting that people maybe they were using not ChatGPT but something else. But yeah, to pick on your point, kind of, I think, well, and everybody is. So one of the things that I see coming through in the financial industry and broader as well is knowledge management. So one of the best, in my opinion, first implementation of Gen AI in any company that has call center is not to have a chatbot that Gen AI. That's not it. The best one is to have an LLM model on top of your knowledge base so that people who are representatives for many in the phones, they don't have to go to multiple systems. And they can just ask the question or even can listen to the question and can pop up the answers coming from different systems. In my experience, that's it's one of the metrics of efficiency in the companies, how much time the call center rep spends on the phone, and that they keep trying to bring that time down because obviously that's human interaction. But majority of the time, those call center reps, they go from system to system looking for an answer. Or you have a really large technology projects that's trying to bring all of those systems together to have yet another system that provides all the answers, and we all know how that sometimes goes. So that's one of the best first steps to implement is to put the Gen AI on top of all of the knowledge that you have. Mind you, you have to make sure that's correct knowledge, right? Because we all have so many files and so many data sitting all over. You want to have the correct one coming back, but that's one of the best use cases that I see many companies kind of going to once they get over getting the chatbots in place. That's a much better ROI and kind of a lot less risk of bad exposure for the company than having a chatbot that's fully AI enabled and behaves as, you know, the woman that we saw in Ken's video.
Yeah. Let me ask you, because one of the things, being in IT, we affect more change on our customers and users than most organizations. And you're also a professor, adjunct professor at NYU. How do you handle, whether it's a student, first of all, two questions for you. Will you let the students use generative AI in their studies and it reports to you? This is for the whole panel, cultural and challenges with implementations. I'm a fan of robots, but I can't implement a robot without some sort of training and communication. It will scare people. But I've seen robots at the airports lately, I've seen robots in restaurants lately, and it's a little disconcerting if you're not prepared for it. And I'm a robot guy. So what do you think those two things? You start us off, and then you guys think about the cultural aspects of it.
So in terms of, I don't think I can control whether or not students will use ChatGPT or Copilot or what have you. And frankly, I don't have a problem with that. Of course, my class is going to be very much based on business case studies and business strategy. So if they're using Copilot, say what should be a case study or strategy to put in place, and then they make changes based on it, or if they, if it's a real case study and they have good answers, again, I can't control it, so I can't really and it's not, creative assignment, it's thinking through assignment. So I guess I'm going to be okay with that. In terms of the cultural stuff, so before we even get to the cultural stuff, to me, we've been using AI forever and ever, and now we have Gen AI, and that went to consumer, so it became a much bigger hype than it was a few years ago. And it's a hype for the companies, of course, there is a race, and we want to accelerate the business and all of that. But there has to be a business strategy first. And the business strategy is not, I want to use AI in my business. The same way as, and I've come to all of this from data, business strategy is not, I'm going to build a data warehouse. And that's not a business strategy. That's not even a data strategy. Forget the business strategy. So I think a big part of the cultural piece, going back to why is it that we have robots in the restaurant? Like, what's the point? Yeah, and maybe there is a point, but it cannot be, and maybe the point is we want to be a cool restaurant that everybody writes up because we have robots. Could be that, maybe the point, but how many restaurants are going to, make money out of that? So, but in whatever business you're using any type of AI, Gen AI, there has to be a business goal. And if you don't have a business goal and you don't have a business strategy, you can build all kinds of things. And if you don't know where you're going, you're not going to get anywhere.
Jay, this not only cultural in terms of what we do to people, it's also, if you combine that a little bit with the cyber view, and because we already scare the hell out of people, AI is going to do that too.
Yeah, from a cyber perspective, and I'll mix a little bit of my cyber and my aerospace defense together. I'll give you an example from that perspective that I started to give. But yeah, and cultural to me is a lot of governance. We have to have the same culture and governance that we have over things today, whether it's managing network folders, access, and who can do things, and closing your financial books, and Sarbanes-Oxley controls and things like that. A good CISO, a good security program is all about secure enablement. That is true. Now, generative AI and that, how's it going to help the end users? I'm sure that it will, but what we know with good guys and bad guys is the bad guys always adjust. Good guys adjust, it just goes back and forth.
It's a form of AGI.
It actually is. You have to just assume that you're breached. Assume they're going to get in. They always do, one way or another, because humans make mistakes. And even AI is a lot of if-then-else statements is all it is. And the reality of it is that there's going to be holes. They will find holes in this, and we will, speed is going to be
Okay, this is a great panel, and we could have gone for an hour. Whether you were here or not, we do this.
We did it.
Yeah, we could go on happy about and you're excited about, and do it 15 seconds because we're overdue, because the last panel was really going on forever.
I think the bureaucratic load that's in healthcare is like an unsurmountable problem if you think about it with where the technology is today. The LLMs are going to be able to solve call it 5-10% of the problem with what they're at today. I talked to the CEO of a startup and he's like, but GPT-5 is coming 6 and 7, and just assume they're going to be 10x, 10x, 10x better. Okay, we need the rest of that curve, just like we got to start now. So I think that's where I get excited about it, not about what it's doing today, but like getting ready for the fact that these things are going to be 1,000 times better in 2 or 3 years, and then you can really make a change.
Jay?
As compute speed and compute cost get driven down to zero or close to it, and it becomes so affordable to doing every process that we can think of, everything we do will become instantaneous.
I think on the consumer side, it's going to become significantly less friction. Even now, we have significantly less friction than we used to have. And with LLMs, being part of pretty much any consumer product or any experience that we have, it's going to be better. And we're going to get used to it and then go back and look at the life right now. So on B2B side though, I think the companies that have put time and money and attention into data will truly differentiate. So data was always a differentiator, data management was always differentiator, but it's been not as noticeable. I think LLM in a few years, it's going to be really noticeable because the companies that did it would reap enormous rewards, and companies that didn't do it will drop out of Fortune 500 or whatever it is, however we want to measure that.
And Steve?
Yeah, I think we're going to see a tremendous increase in efficiency in hospitals, and we need to because
Will people be safe? I don't want to let him go down there, but are people going to be having better lives because of this?
Absolutely. I think the longevity is going to be extended significantly over time with a combination of, as I mentioned, through precision medicine and especially huge advances in diagnostics, diagnostic imaging, pathology, and lab analysis, especially with the interaction between patients and physicians, as well as collaboration with the payers.
And wait till quantum computing gets
I'm
layered
there.
on top of this.
I'm there.
That'll probably
Right.
be empowering beyond quantum.
It's
right.
this is like a drug to me. I love this kind of time. I'm an emerging technology guy. I love this stuff. I can't wait till the robots take over. And so, but thank you. I'll give a hand to our panel, please.